Hi, this is Dr. Strength. I'm a pediatrician here in Waxahachie, Texas. It's right outside of Dallas, Texas. And congratulations on the birth of your baby. Um, my first kind of introduction to the first couple of months of a newborn is I kind of introduce people to the 7 rules of newborns. And what are the 7 rules of newborns? Number one, any baby less than 2 months old who has a fever, it's a medical emergency. The reason is because 2 month olds are, they don't know what their immune system is not mature. They don't know what to do with fever. They don't know how to respond or not respond to a fever. And number two, during the first 2 months of life, they're susceptible to all sorts of infections because their immune system, again, is not matured. So therefore, any fever is an important fever in the 0 to 2 month old rule, 2 month old age group. So, what is a fever? A fever is, as we learn, all medical students learn in medical school, a fever is anything over 100.5. And so I tell parents that 99s don't count, 100 point somethings don't count. It has to be over 100.5. And so anytime you have a fever over 100.5, I tell parents, don't call and ask to speak to the nurse and what do I do? Because all my nursing staff knows that newborns can get sick real fast as well as they can get well real fast. And we don't want to take any chances on anybody less than 2 months old. So for any fever, we tell everybody whose child is less than 2 months old, you have to come in. We have to look at the baby because we don't want to miss something that would be very important. So that's rule number one. Rule number two, any baby less than 2 months old, their liver is not mature. And for that reason, if your liver is not mature, you cannot metabolize drugs. So, therefore, anytime a child has any kind of fever, you cannot give them Tylenol, Advil, Motrin, nothing. The reason is because their liver is not mature and doesn't know what to do with the Tylenol and Motrin. So even one dose of Tylenol can be toxic. So for that reason, I always tell parents of newborns during the first 2 months of life, if the child has a fever, call, make an appointment. Do not give them anything for the fever. All you want to do is give them lots of fluids, bring them in. Rule number three, um, always feed on demand. So if the baby wants to take 1 ounce, 2 ounces every 3 to 4 hours is fine. If he wants to take a gallon, I always laughingly tell parents, if he wants to take a gallon every 30 minutes, he can have a gallon every 30 minutes. It's very normal for any child to spit up with every feed. The only time you worry about spit up if it's projectile, if he's spitting up the majority of the feeds and he doesn't seem to be urinating, then obviously bring him back. But children are messy, so if they spit up with every meal, that can be normal. But in the long run, are they taking the majority? Are they keeping the majority down of their meals? And are they urinating good? Are they stooling good? Rule number four. Um, Studies show that you should not introduce babies to baby food before they're 6 months old. So I always tell parents that in order to avoid reactions to vaccines, foods, allergies, all sorts of things, wait till you're 6 months old to introduce the child to foods. And then we have a whole talk about how to introduce your child to foods at 6 months old. Rule number five, if you notice any discharge from the eyes, any discharge from the belly button, or any funky smells from the eyes or from the belly button, that means something's infected. Go ahead and bring them in. Rule number six, children raised on low iron, studies show, have a lower IQ when they go to school than children raised on high iron. So I always tell parents of newborns that if you're breastfeeding only, then the child should be started on a multivitamin with iron, Polyvisol with iron, 1 dropper full once a day, every day. You can get those vitamins over the counter. You don't need a prescription. And so you start those vitamins once a day, every day. If you're on a formula, just make sure it has iron in it. Any of the major formulas are good, and the majority of them will have iron in them. Rule number 7: children are little fish floating around in a lot of fluid in your uterus when you're born. And when they come out through the birth canal, their little lungs get squeezed by the vaginal tract to force out all the fluid that they've been floating around in out of their lungs. So when they're born, they're going through a drying out process. They're turning, I always laughingly say, from a water fish to a land animal. And so therefore they're going to sound congested off and on, wheezy off and on, snorting off and on, hiccupy off and on. And that's very normal in the first 2 to 3 months of life. So if a child sounds congested off and on, but they're eating good, sleeping good, and having no fever, that means these are boogers, cough, congestion alone. They'll be just fine. Remember in the future, as the child develops, if there's ever any congestion, but they're eating good, sleeping good, and has no fever, that means there's no emergency to get the child any medications at all for that. Most of that will go away by itself. So those are the 7 rules of newborns. I hope that helped. I hope it makes it easier for all the parents of newborns. Thank you.